It is my great pleasure to introduce this study to all of you today. I am Dr. Lona Mody. I'm from University of Michigan and Ann Arbor VA Healthcare Systems. I am the project leader and the team leader of this exciting new federally funded study to target infection prevention in residents with indwelling devices. We will call this the TIP program in the subsequent slides. Before I go any further, I would like to introduce my study personnel. Going from left to right is Jay Fish, who is my research assistant. He will be assisting us in data collection as well as in culturing residents with indwelling devices. Next to Jay is Tisha Moore. She's my research coordinator. She will be helping me coordinate all activities related to this project. Next to Tisha is Linda Wang. She's my research assistant. She will be involved in data collection as well as in microbial procedures. Next to me are Kate Cherian and Kathy Simmons. They will be working behind the scenes to undertake some microbiological and molecular studies related to this project. And next to them, and last but not the least, is Bonnie Lansing. She is my research nurse and she will be involved in all aspects of the study, including enrolling residents, data collection, obtaining swabs, and helping me with the educational intervention. My educational team is comprised of Russell Olmsted, who is a hospital epidemiologist with St. Joe's Healthcare System. He has conducted many educational sessions for the Michigan Society of Infection Prevention and Control. Assisting him will be Ruth Ann Rye, who is also an expert in long-term care and infection prevention, and Tom Fitzgerald, who has helped me create the educational content as well as create pre and post testing. My co-investigators for this complex study include Sarah Krein, Suzanne Bradley, Carol Kaufman, Andre Galecki, and Sanjay Saint, who are from University of Michigan and Ann Arbor VA Healthcare Center. As you all know, multi-drug resistant organisms are very common in long-term care setting. You all have heard that MRSA, VRE, and antibiotic-resistant gram-negative bacteria often colonize our long-term care residents. There is a difference between colonization and infection. Often our residents just have this bacteria asymptomatically and do not have any infections or symptoms from this bacteria. But in some instances, this bacteria can enter our system and cause infections. These infections are often hard to treat because there are fewer antibiotic choices. So what we would like to do is to eradicate these organisms the best we can in long-term care setting. There are certain high-risk residents more prone to acquiring these antibiotic-resistant organisms. These include people who have indwelling devices such as urinary catheters and feeding tubes, those who are functionally dependent on you as healthcare workers to carry on their activities of daily living, those who have been recently hospitalized and thereby exposed to a different set of microorganisms, those who have had a recent antibiotic usage, and those with large wounds. Our overarching goal with this project is to reduce MDROs and infections in one high-risk group at a time. Our first group is those who have urinary catheters and feeding tubes. Why urinary catheters and feeding tubes? Because prior studies from our team has shown that MRSA is more common in these residents who have an indwelling device. We have also shown that ceftazidime and ciprofloxacin-resistant organisms are more common in device residents, and that these organisms are present at many body sites such as nares, oropharynx, groin, perianal area, and wounds. As you can imagine, if there are organisms present at many body sites, there is an increased chance of spread to other frail residents. The organisms spread from one resident to another by the hands of healthcare workers, such as nurses, aides, rehab personnel, housekeeping, and physicians. There is also another way that these organisms can spread, and that's by environmental contamination. For example, VRE and C. difficile spores can stay in patients' rooms for a prolonged period of time, increasing contamination of the healthcare workers and spreading from one resident to another. This leads to our components of the TIP project. There are four major aspects of this project. First, we will expect the healthcare workers to focus on and be diligent about standard precautions. That includes hand hygiene, glove use, and gown use during AM and PM care. Again, our focus is on patients who have urinary catheters and feeding tubes. We will also do bi-monthly in-services involving all healthcare workers, and the topics of these in-services will focus on infection control and prevention. I will mention the topics in depth in a later slide. We will then involve the leadership in assisting us with designing infection prevention protocols and programs to help you all, to empower you all to adhere to your standard precautions. We will gather data on your residents with indwelling devices and inform your facility regarding the extent of the problem and the effectiveness of our intervention, the effectiveness of essentially what you do as a team.